Good morning. Is everybody ready? Thank you for joining us on a beautiful morning here. We are so happy to be on this campus that we look forward to having great educational opportunities in the months to come. I just finished a meeting, very productive meeting with some local leaders who are engaged in the effort to simultaneously save lives in Benton-Franklin County and be able to open up some of our small businesses that we know have been so grievously affected by this pandemic. I met with local hospital officials, Dr. Amy Pearson of the Benton-Franklin Health Department. She'll speak here in a few moments. Riza Khalel of Tridec, Rob Monaco of Lords, John Solheim of Trios, Mayor Saul Martinez of the city of Pasco, go Bulldogs, Mayor Gary of West Richland, Mayor Ryan Luxon, city of Richland, Commissioner Jerome Delvin of Benton County, and Commissioner Brad Peck of Franklin County. And it was a very enlightening discussion, because it showed a unity of purpose. It is our purpose to save lives in Benton-Franklin County. And it is also our purpose to attempt to reopen some of the economic activity which we know has been delayed. And we, excuse me, sir, I'll finish here. So we now, excuse me, as I was saying, and I'll restate this now so that we can make sure we don't have any more interruptions. We have a unity of purpose. That unity is to simultaneously save lives in Benton-Franklin County, and a purpose to be able to reopen the economics of this area. Now, why is it important to have a goal of saving lives in this county? And the reason is that unfortunately we are seeing a very significant increase in the activity of this virus in this county. Let me give you an example of what I mean by that. In May, in Franklin County, there were about 100 cases per 100,000. That has skyrocketed now in late June to over 600 cases in that time period. So this virus, this virus has increased by a factor of 6 during this period of time. And all, I repeat, all of the medical experts, including Dr. Fauci and Dr. Birx, have told us that this virus is increasing. It is not just an artifact of more testing, but in fact it is increasing. So the sad fact is that administrators agree with us that there has been a significant increase in the virus activity. In Benton County, the numbers are similarly concerning. In late May, the numbers were about 50 per 100,000. Today, they were over 250. There has been a 4 or 5 times increase in Benton County of the activity of this virus in the last couple of months. So the fact is that we have a very significant health threat that is affecting these beautiful communities. And they are beautiful communities. They are communities of scientifically literate people. They are communities of dynamic community response. And they are communities that care about one another. So we know what we can do to show that we care about one another. And it's pretty clear. We can wear a facial covering when we're in public because we know that masks can prevent and reduce the rate that we transmit the virus to other people. And that has been shown to a scientifically compelling degree. Now, I know that I'm not the only one that is saying this. I've heard other voices in this community say this. I was impressed to hear General Mattis say this the other day. And it is clear that we now understand that if we want to show love for other people, wearing masks is a very important way to do that. Now, there is another reason why it is important to mask up. And I think this might be a more universal effort. And that is this. If we mask up, we can open up. If we put a mask on, we can reduce the rate of transition. We can reduce the rate of transmission, which means that we can eventually open up our economy. I repeat, I think the number one message today is if we can mask up, we can open up. 100% masking means 100% opening over time. Now, I was very pleased, very pleased by this fact. All of the mayors that I spoke to today, mayors of Pasco, Richland, Kennewick, West Ridgeland, Mayor of Kennewick was not here today. But Commissioner Delvin, Commissioner Peck, all of these leaders have agreed with me that this is something that works. Now, okay, we're going to go inside to complete our discussion. Those who are invited, we will go into a room over here to complete this discussion. All of the recognized media are invited. We'll see you over in a few minutes. Some of this, you may have heard this all over already, but let me repeat some of this. We just had a great discussion with leaders in this community, and it was enlightening and encouraging. And it was encouraging because people recognize that when we can mask up, we can open up. 100% masked means 100% open. And we had leadership in this community who understands that, who understands that masks not only save lives, that prove that we care about other people so that we don't transmit the disease to other people, but it also means that ultimately we can open up the economy and that these things are mutually inclusive. And the number of voices in this community are profound. About 160,000 people are already wearing masks in this community. It's pretty amazing. Over half of this community is already wearing masks. And the reason is that they understand that a mask means that you care about the people around you. It means you care about the grocery clerk so you don't infect them. It means you care about your grandparents so you don't infect them. It means you don't infect people at a birthday party. So what we have found is there is lots of leadership in this community who can help us effectively prevent this pandemic from continuing to spread. And unfortunately, it is spreading dramatically. This has increased. The number of infections in Franklin County has gone up by a factor of 6 in the last several months. It has gone up by a factor of about 5 in Benton County. These are astronomical increases in the infection rate in these communities. And we simply cannot abide the continued loss of life and the continued reduction of our economic activity as a result of the increased action in this pandemic. So fortunately, what we talked about at this meeting was that we have a very effective tool to save ourselves and our lives, but also our economy, and that's to wear masks. and to show common sense about social distancing. This is really good news. So this is a good news day in Tri-Cities. I was impressed that the mayors, every single one of the mayors there today, and every single one of the county commissioners agreed on one central premise, and that the mask can help this community save lives and open up eventually the economy. And I was very impressed by that unity. And as I've said, there's a few other voices you've heard today that don't like that idea, but 160,000 people have already shown that they do like that idea. The vast majority of people in this county understand that we want to reduce this pandemic. And I'll tell you some other voices. Vice President Mike Pence, who yesterday said, masks can help us. Let's wear them. This should be a bipartisan effort, and it increasingly is. The congressman in this district who holds the seat I used to hold, Republican Dan Newhouse, has shown leadership saying we ought to wear masks. So I want to reiterate, the Republican congressman who represents the Tri-Cities has basically said this can help us save lives, let's just do it and get over this argument. So what I'm seeing is a remarkable degree of unity of purpose in this county to get down to save lives and so we can reopen businesses. Now, there is obviously a great interest in doing that. Small businesses are on the ropes. They're very, very concerned about their survival. We understand that. And we're looking for avenues to, if we can get more people to mask up, so that we can reduce the rate of the transmission of this disease, we ought to be able to start to open up some of our small businesses. But we need to show that this can really work. And so we need, frankly, more people to help out and simply put on a mask on a temporary basis. Look, we hope this is not something for the next 50 years, we hope. This is a temporary thing that we are requesting. And it is the law of the state of Washington right now. Now, the other thing that I was impressed by in our discussion is that the local leadership have asked me to impose an obligation on businesses to agree not to do business with people who aren't wearing masks in their businesses. To me, that's impressive. It shows an intentional effort by local leadership to really help their community, and that's something we will carefully consider in the next few days. As you know, that obligation currently exists in Yakima County. It's something that might make sense in this county as well. But I was very impressed that the local leaders had the courage, frankly, to make that request of me. Because if businesses abide by that, that's obviously going to increase mask usage dramatically. Now, I want to tell you that it should be troubling that we're having this debate. There is no debate in the scientific community about the fact that masks work. And it's surprising to me that people are yelling about that still anywhere, including Tri-Cities. Dr. Fauci of the Trump administration tells us that they work. Dr. Birch of the Trump administration tells us that they work. The Vice President of the United States tells us that they work. The Republican congressmen of this district are telling us that they can work. This is not something we should be having a debate about. We need to pull together. We are in this all together, and if we all pull with masks in the next few weeks, I believe we're going to get through this. But we simply cannot expect or allow additional deaths associated with not using something that we know that works. So we will be working with the local leaders in the upcoming days to figure out what makes sense here. But I know it's going to be involving wearing masks because we know that that works. And thank goodness they work. Can you imagine if we didn't have these? We just have to surrender to this virus. Well, there's no surrender in the Tri-Cities. They didn't surrender in World War II or the Cold War, and we should not surrender to this virus. We ought to come out on top. And that involves using our heads and a little bit of cloth on our faces. So I want to thank you for being here, and I want to yield to the doctor who's leading the health district for some comments.
Thank you. Amy Person, health officer for Benton-Franklin Health District. Disease prevention, contact tracing, case management, outbreak investigation. Benton-Franklin Health District's been doing that for over 70 years. The COVID-19 pandemic, though, has moved this to an unprecedented scale. Instead of investigating a norovirus outbreak at a single institution or handling a few hundred case investigations every year, we are investigating upwards of 100 cases a day. Governor talked about using tools. They're the tools that we're asking individuals to use, sometimes uncomfortable for them to change, but the wearing masks is key, as is the maintaining physical distance and limiting the social gatherings. We're using all of our tools in public health as well, and we've asked and received assistance from our city and county leaders, from our community nonprofits, from state and even national leadership, the Department of Health and CDC, to really help us in this battle. Benton and Franklin counties have been hit hard. We have a large agricultural workforce that has been feeding the state, has been feeding the country. We have healthcare workers in our hospitals, in our clinics, in our long-term care facilities. These are all persons who did not have the luxury of being able to shelter in place or to work from home. And as part of that, we have seen very high rates of disease that we will continue to address. We also know too that we have struggled economically, we've struggled with our mental health as well. So we continue to really eagerly look forward to that day when we can help take care of some of the other needs in our community. And that's really going to require, again, all of us to look out for each other. We all need to mask up to move up. Thank you.
Thank you. Ken, want to say something?
Sure. Thank you, Governor. So for those that don't know me, my name is Ken Hohenberg. I'm the Chief of Police here in Kennewick and the Tri-Cities. I want to say thank you to the Governor for being here today. We always enjoy having him come to the Tri-Cities for a visit because he is an Eastern Washington guy originally, and I remind him of that quite often. I get asked all the time as a police officer about wearing masks and what my position is. And I can tell you, I joke a little bit and tell people the only people that I really know that enjoy wearing a mask are bank robbers. And fortunately, we're not dealing with that. But unfortunately, what we are dealing with, we're dealing with a pandemic that we've never ever, in over 40 years of being a police officer in the Tri-Cities, we've never had anything like this before. And masks do work. And I can tell you from being a lifelong Tri-Citian, being born and raised here, people are masking up. And we are getting very good voluntary compliance, Governor. We want our businesses to open up. We want to get people back to work. And as the governor said, this is not just a Tri-City issue. It's not a state of Washington issue. This is a national and a world issue that we're dealing with. And I can tell you from my personal experience, my dad just turned 97. My mom just turned 90 in January. And I have a 2-year-old granddaughter that has a compromised respiratory system. And for that, I believe in wearing masks. And I want people to understand the importance of wearing masks. We need to slow down this disease, and we need to get our businesses open so we can get back to whatever the normalcy was that we had before. The Tri-Cities is a great place to raise a family. It's a great place to conduct business, and it's just a great place to be here in Eastern Washington. So, Governor, we support you 100%. I want to thank you for your efforts. I know, Doctor, you've done a great job, and we're going to continue law enforcement throughout the Tri-Cities to educate. We provided masks in many different occasions as well to people that can't afford masks, and we are encouraging people, mask up so we can open up Washington. Thank you.
Thanks, Ken. Appreciate your leadership.
Hi, my name is David Reeploeg. I'm with Tridec, the Tri-City Development Council. And first, I would like to begin just by thanking Governor Inslee for being here and for inviting me to speak a little bit about our support for local businesses and the community. The Tri-City Development Council, along with the Tri-City Regional Chamber of Commerce, Visit Tri-Cities, the historic Downtown Kennewick Partnership, and the Benton-Franklin Health District have formed the Tri-Cities Open and Safe Coalition with the purpose of protecting health while restoring our local economy. The the coalition's website, tcopenandsafe.com, is a great resource for businesses who are looking for industry-specific guidelines for opening during phase one, and also provides additional guidance so businesses can prepare for our eventual move to a modified phase one and beyond under the governor's Safe Start reopening plan. Businesses that sign the coalition's pledge can choose to be listed on the coalition's website and can also place signage in their establishments to demonstrate their commitment to their customers, employees, and the entire Tri-Cities community. Just last week, we were able to give out 24,000 masks, hand sanitizer, and window clings to local businesses that have signed the pledge. As a community, we have stepped up our efforts to encourage people to practice safe behaviors, including wearing a mask, social distancing, and avoiding gatherings. This messaging has come from our public servants, our community and business leaders, the Benton-Franklin Health District, and many more. In addition, we have recently started an online challenge where folks in the Tri-Cities post a short video explaining in 60 seconds or less why they wear a mask and encouraging and challenging their friends to record similar videos. They use the hashtag #MinuteMaskChallenge and MaskUpTC. So as someone who, like Chief Hohenberg, was born and raised here in the Tri-Cities, I know we are an exceptional community with a great quality of life and a strong desire to support our friends and neighbors. We have successfully tackled some of the nation's greatest challenges through hard work, ingenuity, and innovation. From the Manhattan Project in the 1940s to the global leadership in carbon-free energy generation today. And I have every confidence that this community can come together to solve any problem that we're faced with, including COVID. So in closing, I'd like to once again thank you, Governor Inslee, for being here today and for your tireless efforts to keep people across Washington State safe. And I'd like to again remind everyone that the best thing we can all do to keep our community safe, reopen our economy, and support local businesses is to follow the guidance from the Benton-Franklin Health District and wear a mask. Thank you.
Thank you. Appreciate it. Thank you. Happy to stand for your questions. We're going to start over here, and we're going to go this way. Questions?
Sorry.
Anybody?
So what do you say to people who say, as we heard outside, this violates my constitutional rights to be told I have to wear a mask?
Well, I don't think General Jim Mattis, Mike Pence, Congressman Dan Newhouse, many doctors, police chiefs, all the mayors and county commissioners that I met with this morning would be saying, let's go violate the Constitution. Look, this is a pandemic. It is killing people. And we have a community response, and only a community response can be successful. So we have to act together. And that's what we're doing. We've done some great work in the state of Washington by bending the curve down. In Tri-Cities, you've got 160,000 people wearing masks already, and I'm confident that's going to grow. So this is simply a response to a very, very deadly disease, and there's nothing in the Constitution that says we should surrender our loved ones to a virus. There's just nothing that says that. I may also note that no court has held, which basically that's how we make decisions in our state, in our country. The courts decide this issue. And no court has said any of these things are unconstitutional or illegal. They just have not. So I know that there are some voices, some of which you've heard today, but no one voted for those people out there in the courtyard today. They voted for the mayors. They've hired a police chief. They voted for Congress people. And those people are saying masks make sense. That's how democracy works. And democracy is working to fight this pandemic. And thank goodness we have a democracy, and we're going to keep it. But we're going to keep it by wearing masks. That's what works. Yeah?
Looking a little bit more regionally, I'm curious if you're thinking there might be areas that would have to move backwards as outbreaks happen once looking forward to it.
Yeah, the question was, are there regions that might have to move backwards? We don't want to think about that because we like to plan on success. But it is a reality that if we don't contain this pandemic, if it continues to increase, that is a distinct possibility. But the good news is we have tools to stop that from happening, and that's the thing that I think should be encouraging. You know, to win the Cold War, we had to have scientists invent technologies in Tri-Cities that had never been invented before. People couldn't even dream about the things that the Tri-Cities engineers and physicists invented. We have something that's just a piece of cloth that can win this fight. We don't have to invent an entire new technology. And so we ought to be glad that this thing can really work. And again, it's used. And if I can, let me address some of the concerns I've heard raised. You know, people have said, well, I don't want to wear a mask because I'm just a tough, brave soldier, and if I get COVID, I'll just, you know, whatever. I'm just going to take care of me. But fundamentally, that misunderstands what a mask is. A mask is, when I wear a mask, it's to protect you. When you wear a mask, it's to protect me. That's the principal reason for a mask. So you might be the most macho, risk-taking person who doesn't care about their own health in America, but if you do care about the rest of your community, then it really helps to wear a mask. And frankly, one of the most powerful messages I heard was from Vice President Cheney, Republican Vice President Cheney, who I've disagreed with virtually on everything our entire political careers. But his daughter put out a picture of him wearing a mask, and she said, "Real men wear masks." I couldn't say it any better than that. It's a pretty manly thing to not want your children to get infected because you breathe on them. It's a pretty manly thing to wear a mask so you don't infect the grocery clerk who's serving you food. That's a manly thing. And I think it's a very patriotic thing to do in this regard as well, because you're protecting other people around you. Yeah. Yes?
As far as messaging goes, how many different languages are being used to get that message across?
By the way, masks are a very womanly thing, too. I want to reiterate. I was just quoting Dick Cheney's daughter. I'm sorry, what was your question?
I was just wondering if the message is bilingual. I mean, we've got a lot of different languages in this state, and it seems like most of the messaging is in English.
Yes.
I was wondering if there's an effort underway to broaden that.
Yes, this is a very, very important point. And I was encouraged, the local leaders, the mayors have made it clear that they want this message to be multilingual, certainly in Spanish. Very, very important point. I'm convinced they're trying to do that. They've hired a marketing agent who's going to help them design a program to do that. The state of Washington is also going to have a communication effort to communicate information, scientific information about masks, and we're going to make sure that that's multilingual. Obviously, that's important because a lot of the people who feed us in the agricultural industry are Hispanic, and they deserve protection. So yes, that would be a very important part of our effort. Yes?
What do you have to say to those, especially in our areas, that haven't moved out of phase one? So what do you have to say to those who are frustrated right now and seeing other counties moving into phase two, phase three?
Right.
What do you have to say to those?
Well, what I would say is we need to try to reopen up our businesses as soon as humanly possible. And we need to do the things that will allow us to open up our businesses as soon as humanly possible. And that's to wear a mask. Mask up so we can open up. 100% mask means 100% open in some sense. So if we do these things, I'm confident we're going to have success at some point in reopening. If we don't, it's hard to understand what circumstances will allow us to move forward. Because this pandemic, as I've said, has gone up by a factor of 5 or 6 in this community, and it continues to grow. So something needs to change here, and the thing that we ought to have confidence in is simply wearing a mask. And I do have confidence about this. And I want to tell you, I'm deeply appreciative of the local leadership in the Tri-City community. They were very articulate. They were asking to reopen some small businesses now to give people some hope. That is a rational thing. We are thinking about it literally on a daily basis. So I just appreciate the local leadership we're seeing here, but actually from both parties, frankly. So thank you to them. Yeah.
Guillermo King, there was a local social media post gaining traction about packing the local park on July 5th. Basically, people are against what you have to say in the mask order. So what do you have to tell to those people who
Well, look, as I've said, the majority of people in the Tri-Cities are wanting to reopen and do understand if we wear a mask, it'll help us reopen. As I've said, over half the people are already doing that. And I'm convinced in the upcoming weeks that will grow dramatically. It is not surprising that other people that speak in protest. We never get 100% of anything. All I will say is if people do want to do that, we really hope that they wear masks, and we really hope that they socially distance. Now here's the concern. One of the reasons we're getting an uptick in this pandemic across the state of Washington is that people are just thinking somehow we're over this. This is something about yesterday's business. So they're having more family gatherings of 20 people, and they get close and they do what we love to do and they hug, and then we infect each other. We simply, if we're going to save lives, have to remain committed to this for some longer period of time. And that has to do with political activity as well. So we just hope people will protect people around them if they do go to a park, socially distance, wear a mask, say anything you want. This is a free country. Say, you disparage any governor or senator or president that you desire, but do it with a mask on so you can save lives.
Governor, after receiving recommendations from the local leaders about masking up and no service, no mask, no service, how would you enforce that?
Well, first off, it is the law, and so we hope people realize it's a virtue to follow the law, and that's why it's being effective. What we have found is that we have had very large-scale adherence to the law. So when we issued the Stay Home, Stay Healthy order, huge compliance. We only had to take legal action in just a handful of cases to get people to comply. And the reason is people have understood that we're all in this in together and that this is a matter of life and death. We believe over time that will be the same situation with masks. We have seen increasing numbers just in the last week or two of frequency of people wearing masks. So we're heading in the right direction, but we got to outrace the virus on how fast we increase this usage. So I'm convinced that's going to be what really works here in this regard. Now it is a misdemeanor, but we shouldn't have to go that route is what I'm saying. Now there is something we are considering, and that is imposing an obligation on businesses themselves to not do business, not sell goods or services to those who are not complying with the law. We're giving consideration to that. The mayors I met today have asked us to impose that requirement as we did in Yakima County. So that's another avenue we have that would increase compliance. Yeah.
Just to confirm, you said local officials specifically requested the same kind of Yakima no mask, no business?
Correct.
And that was Richland, Pasco, Kennewick, and West Richland?
Richland, Pasco, West Richland, Kennewick mayor was not there today. So I think he signed the letter that essentially asked, the letter actually asked the local county health department to do it, but then today they asked me to take the action, if I understand it correctly.
Specifically want to see a no mask, no business policy?
Correct. Yes. And they were unanimous in that view today of the mayors we spoke to. Yes?
One of the big challenges that the Tri-Cities has had since the beginning of this is getting enough testing supply.
Could you excuse me for a moment?
Sure.
Just a moment, I'm sorry, because I really need to add something to your question. Now, to be clear, the mayors also asked to open up some small businesses as well, right? So that was an important part of their message. And they articulated it. They basically said that they thought that we would get more compliance with masking if there was some kind of movement of some forward movement. And they made that argument. So I want to make clear about that.
Would there be, if that type of thing, would there be opening of businesses if the person comes in with a mask? Would we see some
So that's the thing that they urged.
frustrated because they feel like they're treading water?
Yeah, that's what the mayors articulated, and it's what we're thinking about. And I've told them I think about this every day, literally. I talked to John Weisman, who is here, and Rocky Bono, John Weisman, Secretary of Health. Rocky Bono, who has led our effort on the hospital assessment. By the way, I should note this. We are concerned about the hospital capacity in Tri-Cities. They have been creative so far, but the report we had yesterday, there's really only one more ICU bed available in Tri-Cities at the moment. Now, the hospitals told us they thought they could build ICU capacity from a physical standpoint, but they did have concerns about a staffing if we continue to see this pandemic grow. And as you know, it's becoming more difficult because Yakima has had to transfer patients out of Yakima County, including, I believe, some to Benton-Franklin County. So the hospital capacity going forward is a concern of ours, particularly because we're seeing some of this uptick of behavior across the state of Washington. Excuse me, I'm sorry.
So as far as testing is concerned, it seems like the Tri-Cities has really lagged behind the rest of the state and even behind other states in getting enough testing here so that we can get a true estimate of what the problem is here. Is there anything that your administration is able to do or coordinate with Dr. Person and the health district to ramp up that testing even more to get a better handle on what we're actually dealing with?
Yes, and we are looking at some remote testing facilities that might be easier for people to use as a possibility. John, do you want to address that? I'm going to ask John Weisman, our Secretary of Health, to address that issue.
Yes, thanks, Governor. Yes, so there are 2 community test sites open right now, and our staff have been meeting with the health district staff and are working on bringing in mobile testing. We added that capacity in Yakima this week and are working out the bugs and intend to be able to bring it here to the Tri-Cities in probably next week. Yep.
We have time for just a couple more questions.
Yeah, I want to reiterate something. Excuse me if you heard it out there, but I do want to say it again. Look, some people, including, the president, has argued that there's no problem here, that the virus is not increasing, it's just a matter of we're testing more people. The problem with that is it just is not true. And virtually every medical person who has evaluated this, north, south, east, west, urban, rural, Republican, Democrat, have concluded that this virus is growing in our country and certainly is growing in Benton-Franklin County. It would be wonderful if we could ascribe this increased hospitalization. The number of people who are hospitalized has doubled in this community in the last, I think, about month. Doubled. That's not a result of testing. That's a result of people not being able to breathe. We need to allow people to breathe. And that's what this effort is about. Yes?
I think a lot of the concern is, of course, individuals that are affected by these long-term closures we're having, but also overall the effect on the state economy, state budget, which trickles down to local cities, social services, that kind of thing. With the new fiscal year starting tomorrow, what kind of measures are you taking or hope to take to kind of account for that shortfall in the budget?
Yes, well, we have been acting promptly. First, I vetoed about $445 million of spending in anticipation of this loss of revenues. We've also done mandatory furloughs where we've saved about $55 million of payroll for the state of Washington. And I have encouraged my colleagues in other agencies to do the same. That would save about another $90 million. So we've cut out of our budget, probably over $600 million in the last few weeks. But obviously we have many more difficult decisions to make. We're going to look for more clarity when we see what Congress is doing to see if Congress is going to help us or not. That'll help us really make some more financial planning. We're hoping that happens sooner than later. And I really hope that Mitch McConnell's viewpoint that a solution is just to let the states go bankrupt is not the final result. We're the people who get teachers in the classroom and nurses in our mental health facilities. And just saying that we can just go bankrupt is not an acceptable solution here.
I think a lot of frustration I have from the community is with the shutdown and the closures because they're being enforced. And yet on the other side of the state, CHOP is still not necessarily under the rule of law. Do you have any comment on the state of things in CHOP?
Well, I'm just very hopeful that the city will succeed in restoring police services to that area. It is absolutely essential. I believe the city is moving in that direction. We hope they're successful as soon as possible. But, you know, it's not a solution to say somebody who can't breathe in Cadillac Hospital and say, well, no problem because there's CHOP. No, we got to save lives here regardless of what's going on in the world. There's a lot of things that I don't like going on in the world. But number one, I don't like people dying in Tri-Cities unnecessarily. And if we don't mask up, a lot more people are going to die unnecessarily. And I'm against that. I'm for people living and enjoying this beautiful community, and that's why we're here today. Anything else? Yeah. Oh, this lady hasn't asked one, I don't think.
Thank you, Governor. At the beginning of all this, some pop-up tents for extra testing was sent away in Yakima County, and now with increased numbers of people in hospital beds and running out of hospital beds there and here, are there going to be more chances for us to get additional hospital beds or pop-up facilities with the National Guard or with the state's help in case we get to that point where we don't have any more beds or a lack of staffing?
So that is a possibility. At the moment, the local hospital authorities have told us that they have the capacity in their buildings to establish, I think Cadillac said, another 20 ICU beds to begin with. Other hospitals had similar ability to expand their beds in their existing buildings. So that would be the first priority. If those become not appropriate, then you go to a transfer situation. Can you transfer people to other cities who have capacity? Then if that is not enough, yes, those pop-up hospitals are certainly a situation that could be considered.
If I can have a follow-up.
Yeah.
Whenever it comes to PPE for that, with Yakima, they were saying their staffing was the issue because their people were seeing symptoms or having to be isolated because they had been exposed. What about that if they don't have the staff or they don't have the PPE to keep up with those raised cases?
Yeah, PPE has been extreme frustration early on. That's why I've been so adamant that we'd ask the president to be more aggressive on its production. We think we're in pretty good shape in the medical community for PPE right now. I think there's adequate. PPE is not the limiting factor, but the number of staff is a concern because first off, some of the staff have themselves tested positive. So we have heard some staffing shortages at various counties, and that would be a concern here. Can you get the right skill set in the nursing staff to do the ICU kind of nursing? That is a concern. And that's why we want to mask up so we don't overload the hospitals. That's why we're here today. Yes?
Can you or maybe Dr. Wiseman specifically address the status of the county's applications to move to a 1.5 or 2, other than it's paused?
Well, let me handle that, John, and I'll ask John if he wants to add anything. We have been contemplating this literally on a daily basis since we saw that application. And what we have been trying to assess is it too big of a risk to start reopening? Because when you reopen, you get more interactions, and this virus doesn't have legs. You know, it doesn't have legs. It can only transfer when we get close to one another. So the more times we get close to one another, you get more transmission. So we've been asking ourselves, is it too risky to do that right now, given the fact that hospitalizations have doubled here and infections gone up 5 or 6 times? That's a hard question to answer. But we have also been trying to figure out, is there an upside which encourages people to have hope to see some movement and therefore maybe buy into the whole masking regime? That's also a reason to take some action. We're still trying to balance those things. We have not made any definitive answer. What I will tell you is that we will be watching Benton-Franklin in the next several weeks and days, and we're going to be looking to see if more people are wearing masks. And I can tell you that the more people that wear masks, the more likelihood it is, and the sooner that we can begin to reopen up. Now, that reopening may not look exactly like phase 2. It may be sort of 1.5. But I just hope people mask up. It will make that decision a lot easier and a lot clearer for us.
Well, while it's paused as far as its ability to move forward to phase 3, how much is that going to impact your decision on on Benton and Franklin counties, since there seem to be a lot of people who are heading over to Walla Walla to take advantage of the phase 2 over there?
Well, some, and you've pointed out one of the more difficult parts is decision-making, because we know people do travel. The best way I can answer that, it is a phenomena we're aware of. We try to factor it into our decision-making, and that's the best way I can answer that question. Yeah, I had one more question. I probably got to get going here.
I just have I would like to comment on to the Latino community who refuse to wear masks, especially here in Tri-City, because in Pasco specifically, we have high cases of coronavirus in the Latino community. So maybe they're rejecting to wear one, or they just don't know much. What would you tell those people that are just rejecting to wear one?
Well, to the Latino community, this is a community that has been bitten hardest by this virus. And it's the one we want to particularly help people avoid this COVID-19. And the way to do that, if any community is going to wear a mask, that would be most helpful, because we have a disproportionate number of Latino people who have been infected. Now, we're also trying to figure out a way to support people, many of whom are Latino, who have to isolate if they become positive. This is a very important part of this strategy. When we find people who are positive, it is absolutely imperative that those people not go to work, not go to the social settings, isolate themselves, and their families also isolate. This is the only way we're going to break the chain of this transmission. Now, when that happens, people, have difficulty missing a paycheck. And people can get unemployment, but that takes some time. So we want to build a support structure to support those families while they're isolating. I talked to some of the local leadership about this today. There is such an effort in Spokane County. There are 300 volunteers. They've even given pulse oximeters to these families. So you put it on your finger and it tells you what your oxygenation of your blood is. We need that in Tri-Cities, frankly. We need people to wrap arms around these families that have to isolate, including Latino families who have been hit so disproportionately. So we look forward to moving forward. Now, we also want to provide some help for folks who are undocumented, because we know people who have been feeding us who are not documented, but we want those people to be protected as well. So we're working on that as well.
John Lester, I just want to ask,
Yep.
Tomorrow's July 1st, a whole bunch of businesses are going into another month closed up, especially downtown Pasco. A lot of very small businesses that haven't sold any of their products the last 4 months. And then you gave an incentive of $5 million grants to these businesses. I saw a list in Yakima that there's 70 businesses of all the businesses in Yakima County received help. In Pasco, in Tri-City, I haven't seen that list yet. But $5 million, are you looking to add some more money to the small businesses and help them out? Because they're not going into 4 months.
I think that depends a lot on what Congress does to see whether they give us some assistance so that the state could do some additional things like that. And that's why we're very eager for Congress to act. I talked to a senator today about this subject who's being very vocal to try to get the Senate to act. So we hope that that is the case. But I am doing the single most important thing I can do to help open up, and that's to defeat this pandemic. And the best way to defeat this pandemic is to mask up. So that's the most important work I can do. That's why I've come to this Tri-Cities. It's a wonderful community. I got to represent it for 2 years in Congress, and then the voters freed me for other duties. But my connection to this place has not wavered, and I do believe, I just tell you, I am serious about this. I was encouraged about my meeting today. I was encouraged because I saw leaders who have been elected, who want to work together to get on top of this pandemic, who understand the power of masks. And yes, there's controversy, as there is in any great noble endeavor. But the vast majority of people of this county want to beat this pandemic. And they want to work together to get us to wear masks. If we do that, I think we're going to have success. So thank you so much. Be careful and please mask up. Take care.